what are the best injections to get from your pain doctor for neck pain? Now, interesting question. It totally depends on what the injection is for, because many different things cause pain in the neck. So there is really no best injection. I'm going to name the types of injections we do. Everybody's heard of an epidural. Now, epidural is kind of a shotgun. Put the medicine, sort of spread it around everywhere and hope it reduces the inflammation. It's not very specific. Some people get a transforaminal epidural. A foramen is the hole where the nerve goes through the spine, and they'll put the medicine directly in that location. I do that transforaminal epidural, or TFE, if I want to know, is that nerve pinched? Is that causing the symptoms? And maybe if I put a little medicine, a little steroid with some numbing medicine, I'll find out, A, is that the source of pain? And B, maybe the patient gets a long-term relief from the steroid part of it. So it's therapeutic and diagnostic for me. Okay, the other thing that happens a lot in the neck is arthritis of the facet joints. I have arthritis in my upper two facets on both sides. My pain doctor injects these, and I'm good for a year. So about once a year, I do facet blocks, facet joint injections, or medial branch blocks, same thing, basically, in the facets. Facet pain is brutal. It can be very sharp and stabbing in the upper neck, which is be right behind your ear if you have facet joint pain there. Facet joint blocks are very helpful in the cervical spine. You also get it in the low back, but facet blocks work better in the neck, in my experience, than in the lumbar spine. And the last type of injection is called a selective nerve root block. It's a little more specific than a transforaminal epidural, but it's again going right to the nerve that's pinched, putting the medicine just a little bit right around the nerve, not really trying to shoot it up along the spine like a transforaminal epidural, but it's also very selective. And we do that also more as a diagnostic than a therapeutic tool. So those are the four basic type of blocks that we do in the neck, or injections in the neck, that relieve neck pain. And they're very different. And your spine doctor should be directing you to get the correct injections, because not everybody gets the right shots. I see some people in here getting facet joint blocks. I look at their scans, they have normal joints in their neck. I'm like, that's not your problem, it's the disc. Happened today, I had a patient today with that. Okay, we got to do something around the disc. Transforaminal epidural is what I use around the discs to see if that helps. So those are the types of injections for neck pain, and I hope it helps you. Call me if you have any questions. Thanks.